Call Calcagno and Rossi Vein Treatment Center for a free screening.
Painful, swollen, varicose veins are caused by venous insufficiency, a medical condition better known as venous reflux or simply vein disease. Well, Dr. John Rossi is co-founder of Calcagno and Rossi Vein Treatment Center in Mechanicsburg. He's one of our vein doctors, and he joins us for this. He's going to share a new minimally invasive procedure called VenaSeal. It's fun to play with the gun. More on that in just a moment. VenaSeal, what is this? It looks pretty simple.
Yeah, you know, every once in a while in your medical career, technology comes out that totally changes the way we treat a disease process. And we did the first 2 patients in Pennsylvania last week, and this is really a phenomenal new technology that I think is going to revolutionize the treatment of vein disease and make it more minimally invasive than it has been in the past, and truly has remarkable results. No anesthesia is required, and patients basically walk out with a Band-Aid on. And it just came out, was released by the FDA. There's been the 9th and 10th patients in the east of the Mississippi we did last week, and the studies show that it's extremely effective, 99% effective. No incidence of clots in the studies, and just a remarkable treatment.
Well, let's show folks how it works, because we have some kind of video animation to show folks. What are we looking at here? This is the gun.
You're looking at a small delivery gun that delivers an aliquot of a special adhesive called VenaSeal that polymerizes and becomes glue when it comes in contact with human blood or liquid. And so this catheter is introduced in the vein through a tiny little puncture site, and then basically what occurs, and we'll see on the video, that the gun will deliver a small aliquot. That's the vein being compressed, and then you can see the glue being delivered into the vein. It's pulled back. It's actually stretchy, so it stretches as you pull the catheter back. It's not hard like a crazy glue substance, and so you can't feel it from the outside. And then the operator's hand compresses the vein, and basically the vein is glued shut.
Wow.
And that's how the vein is treated. So that eliminates the abnormal pathway by which the blood is falling backwards into your leg, pressurizing your veins and causing varicose veins. Truly remarkable development. The vein and the glue are then absorbed by your body, and that treats the disease. So from vein stripping to then radio frequency or heat ablation, and now to gluing the vein shut. Small Band-Aid is then placed on the leg, and the patient walks out of the office. The treatment takes about 20 minutes. There's no need for a stocking, and they can go right back to what they were doing previously.
It does seem like such a simple procedure. I mean, complex, I guess, behind the scenes to develop the technology, but so easy on the patient. What do you think really the main advantages of this?
Well, the main advantages is, number one, we no longer need any anesthetic to treat the leg. Previously, when we used laser or radio frequency ablation to treat a vein, you had to numb up the leg or they would feel the heat. So that's not necessary. They can have a small little puncture in their leg. It's like drawing blood. So there's no discomfort during the procedure. They don't feel any of that. They can go back to doing whatever they were doing. There's no need for post-operative compression. And like I said, the major advantage is the absolute no necessity at all for any kind of anesthetic on the extremity.
This must be so cool for you to talk about, isn't
exciting.
it? Are you just
this
like
is
geeking out over this technology?
I really think this is an exciting treatment modality.
Now, so folks at home are thinking, you know, they're dealing with something in their legs, whether they think it's just cosmetic or they're having some medical, you know, discomfort because of those veins. You have screenings next week.
Yes, we do. We have a vein screening, and this is a special vein screening. We're offering this vein screening during Veterans Day week for veterans and their immediate family, that they can call the office between 8 and 3 and come in and get an evaluation and see if they have varicose vein disease, and then see if there's anything that can be done and have an educational opportunity. And that's our way of saying to our veterans, thank you for your service.
And they can learn more about this, right? How this might be the ticket for them. We've seen that you have brought us over the last year or so many different procedures, I think, that really make a marked improvement on people's lives and the pain that they're in.
Rapidly advancing technology to treat a disease that used to be treated with surgical stripping under general anesthetic, and it just keeps getting better and better and easier for patients so that they can have this disease process treated.
And you're walking out with a Band-Aid on, just a little Band-Aid.
Yep.
Doctor, thanks for being with us again.
Thank you,
it
Amy.
is really cool technology.
Call Calcagno and Rossi Vein Treatment Center for a free screening.